So we've just seen in the news the end of last week that NHS staff in England are getting a 6.5% pay rise. How does that compare to the situation here?
Well, first thing I should say is it's 6.5% split over a 3-year deal. So it's not necessarily a huge, here you go, 6.5%. Compared to here, obviously, the pay negotiations are still ongoing over here, so I can't really say much around that without prejudicing what's currently being negotiated. I think one of the things that we need to bear in mind with the UK deal, though, is it does involve some changes to terms and conditions as well. So it comes with, should we say, a health warning, I suppose, is a good phrase to use, the UK deal, because it is 6.5 over 3 years with some changes in terms and conditions. And of course, the GMB union has actually rejected the deal, whereas the rest of the unions have accepted. The GMB, I believe, 90% of members voted against because they didn't believe it was the right deal for them.
Now, could deals like this in the UK, could they have an impact on staff retention and staff recruitment in the Isle of Man?
Obviously, it's something that we have to have at the front of our mind, because if there does start emerging to be a disparity between the Isle of Man and the UK, both in terms and conditions and in terms of pay, then obviously that is a concern, because it could lead to people making decisions based on that. But I think certainly we haven't really seen cases of that in the past, and hopefully we won't in the future. But obviously what they do in the UK in terms of terms and conditions and pay is very, very important that we monitor that and we keep on top of it. I think, again, though, one of the things I should emphasise about the 6.5 that has made the news is it is a 3-year deal. There have been certain people quite critical of the way the deal is spread out over the 3 years as well. And also, like I say, there has been terms and condition changes in the background there as well. So while it makes a great headline on BBC News and for some of the newspapers, if you drill down into the detail, things aren't necessarily as they appear.
But one thing about the deal is, and I know you say you don't want to preempt any of the negotiations here in the Isle of Man, but the money for this is additional funding to fund the pay increases rather than it coming out of the overall budget, so it shouldn't have an impact on patient care and services. Here in the Isle of Man, it's been said for years now by the Treasury that any increases in pay will have to come out of the pay budget that's already there, which could essentially, if any pay rises are given, have an impact on staff numbers and frontline services.
Well, the thing I should mention is it's a pledge at the moment for it to come as additional funding. It hasn't actually been written into the budget yet. That will be for the Chancellor to decide at the next budget round. But it is a pledge that has been made by the UK government that it would come as additional funding to cover pay awards. As you rightly say, the Isle of Man policy at the moment, the Isle of Man government policy is that pay awards must be found within existing budgets. But obviously, like I say, the best thing I think we can do at the moment is continue with the pay negotiations over here as we are and monitor what is happening in the UK. What is important is we get the deal that's right for the Isle of Man. And I don't think necessarily we should just be looking at the UK and following suit, because, as I say, there are terms and condition changes in there as well, and it's not quite as necessarily good as the headline grabbing.
And are you confident that however the negotiations go here, that the Isle of Man will remain competitive or will be able to be competitive in recruiting staff?
I think so, and I mean, it's a very different environment for staff to work in over here. We do have our problems, and I'm not going to run away from that. We've done interviews about that before, about the need to improve the work situations in some areas and build up staff morale. But overall, I think the Isle of Man is a great place to live, and it's a great place to work as well. And within the health service, what is important is we continue working on that environment to make it a better place to work. Because when people look at jobs, they don't always just look at pay and terms and conditions. They look at the whole environment of where they're going to be living and what work is going to be. So alongside incentivising via pay and terms and conditions, what we also need to be doing is working on making the health service a better place for people to work on a day-to-day basis and improving the culture there, because that is as much of a selling point, if we get it right, as anything else.